Hello, great doctors. Welcome to Dr. Led channel on the YouTube. Thank you for watching my video today and kindly subscribe to my YouTube channel to receive the new updates that will help you with your medical education. So today we are going to talk about a challenging situation, which is breaking bad news. It's actually challenging because you may find it a little bit difficult to deal with a patient. You know already about his test results or her test results, for example. So how to deliver this information in a very professional way. So let's talk about that today. Okay, so the aim for any health professional is to use their skills to deliver bad news clearly, honestly, and sensitively, in order that patients can both understand and feel supported. So, the aim for any healthcare professional is to use their skills to deliver bad news clearly, honestly, and sensitively in order that patients can both understand and feel supported. This is the main aim of breaking bad news. Okay, so first part of breaking bad news, as any case whenever you're dealing with a patient, is data gathering. What does data gathering include in breaking bad news? First of all, you need to take focused history. And what does focused history mean? Focused history means number one, P1, which is representing complaint. If a patient comes to you, she is having, for example, pain in her tummy, you already know the investigation result of this patient who came before and she came today. She wants to receive her investigation results or test results. So you need to take a quick history, quick recap about the presenting complaint. So P1 is really important to ask, why did she come to the hospital or to the clinic in the first place? Number two is maftosa. Maftosa, which is whether she has any medical conditions, whether she has any medications, she's taking any medications currently, whether she has any allergies, or whether he has a family history of any medical condition to mention. Travel history, if relevant, occupation if relevant, sexual history if relevant, and you need to ask whether there anything else she would like to tell you before proceeding. It's really important also in those situations to ask about psychosocial history, whether this patient is facing any stress in her life nowadays, whether she needs any support in challenging situations is really important. So this is apart from the focused history. Then in the data gathering part, you need to do examination. Examination of the patient, yes, even if she comes to you for the second time or third time, you'd like to examine her or to examine him in order to make sure that they are improving or whether there is anything else had popped up and is relevant to the situation. So examination is a real important thing in the data gathering part. Okay, so let's talk about the management part here. In a patient, you know about his test or her test results, for example, and you'd like to break the bad news. So you need to disclose a diagnosis in layers, which means gradually. Never say, Mr. X, unfortunately, we have found that you have prostate cancer. Okay, so please you try to disclose the diagnosis in layers. How to disclose diagnosis in layer? For example, Mr. Joan, you came to our hospital because you were complaining of difficulties in urination or weight loss, and we took a sample from your prostate gland. We have received the prostate gland test result today, and I want to tell you about the investigation result. Okay, so this is how to disclose a diagnosis in layers. Never tell the diagnosis directly like that. Okay? Then you need to involve seniors actually. Try, please, in every single situation, you need to involve your senior. And you are an FY2 doctor. You always seek senior help. Senior may come, they assess the patient, can order some tests, further tests. So try, please, always to involve your seniors. So please refer to specialized team or multidisciplinary team if required. Really important. If the patient comes to you and you have found that the test results reveal that this patient is having prostate cancer, for example, you need to refer the patient to a specialist team if required. Specialist team referral is in 2-week time, which is an urgent referral. And you need also to tell the patient about the red flags that he should or she should be aware of. For example, if this patient comes to you with prostate cancer problem, you need to tell at any point of time if you feel any dizziness, any back pain, any bleeding from your front passage or something like that, please let us know immediately. Could be a sign of something serious. And follow-up. Follow-up appointments are really important because by that you will know the progress of your patient. Patient is seen by a multidisciplinary team, so you'd like to follow your patient up to make sure that your patient is improving afterwards. And the last part is interpersonal skills. Interpersonal skills are really important, and the more important thing is to be empathetic with your patient. It's really important to show empathy, really important to use your body language to express feelings towards the patient. But if the patient, for example, is crying, please never cry. Being empathetic means you are feeling sorry for what the patient feels. But you should never cry. You should never put yourself in the feet of the patient. You already feel that this patient is in pain or is not feeling well. So you please try to show your feelings towards this. Okay? And then offer support. When the patient is in your clinic, please first of all ask them whether they came alone or they came with someone. And if they came with someone, you can ask her or ask him if you'd like to bring him in the clinic or in the ward in order to attend this meeting, to support her or to support him while disclosing the diagnosis. ICE always is very crucial, very important. Ideas, concerns, and expectations, please try to include them in your station or in the real life situation, because it's really important to ask the patient about their ideas. How do you think? Your concerns. May I know what concerns you the most? And expectations. What do you expect from us to do today? It's really important. So, as we mentioned, you need to disclose a diagnosis in layers. Never disclose it directly. You need to disclose the diagnosis in layers. After disclosing the diagnosis, a challenging diagnosis, please give a pause, for example, for 4 seconds, and never talk. Let the patient show their feelings, show what they feel. For example, if they are shocked or something like that. So you need to give the patient time to express their feelings and never interrupt them, because this may mark you down in the interpersonal skills part. Crying. If the patient is crying, as I mentioned, please never cry. But instead you can offer tissue if you do have. And please never interrupt the patient while she's crying or while he's crying. Last but not least, please offer support again. This patient already comes to you and you have disclosed the diagnosis. Now she might be in shock. She might be crying. She might not understanding what's going on actually. So please again offer support. For example, Mrs. Jane, I can see that you're really anxious, you're really frustrated. So do you need any help or any support at the moment? Would you like if we can offer you a drive to home? Okay, by that you are showing that you are really caring about your patient, and this is patient-centered approach. Okay, thanks so much doctors for attending this session today. Kindly subscribe to the YouTube channel and please feel free if you need any help or support, leave your comments in the comment panel. Thanks so much, stay tuned and see you again.